Great, thank you. Good afternoon, everyone. I am Melissa Garrett. I am the Policy Director for the Child Development Division, and I am a member of a child care solutions-based team that is a FEMA-hosted team, really in Vermont, focused specifically on really stabilizing the child care field, but also thinking about how we're preparing ourselves in the event of any future pandemics or natural disasters. So it's been an interesting and really cool experience to work with some partners that we haven't typically worked with before to really think about how we can build resiliency and skills in our field to support our future addressing of any natural disasters or pandemics. So this is the second webinar that we are offering, providing some technical assistance to Vermonters around supporting childcare. The first one was on the PPP, the Payroll Protection Program, and we hosted that about a month ago for providers on how to access that program. And we're pretty excited to now be focusing a little bit on data and the use of data to understand and then drive decision making. So really grateful to FEMA for pulling all of us together, and especially to the U.S. Army Corps of Engineers, who have lent us some pretty fabulous and knowledgeable people about data. So without any further ado, I give you Caitlin Volk from the U.S. Army Corps of Engineers to take you through today's content.
All right. Thank you, Melissa. My name is Caitlin Volk. As Dora and Melissa mentioned, I'm a member of the Army Corps of Engineers team that has been working with FEMA to help with data analytics for the COVID-19 pandemic response here in New England. So this is a brief overview of how the workshop is going to go. I'll do an introduction on data use. My colleague Jeff will take over to talk about our data use in the coronavirus response. And then my colleague Ben will talk about how data can inform policy, and both of them will also go over some tools that we've developed for FEMA. And then we'll end with a questions and answers segment. And if you have any questions during the presentation, the Q&A feature is enabled. So you can type it down as it kind of comes to mind. And either one of us who isn't presenting will answer those questions right off the bat, or we'll save it until the end and address them then. So the coronavirus as a new and emerging virus had a lot of questions that needed answering, and still has a lot of questions that need to be answered. Some of these include: what are the risks of COVID? How can institutions provide critical services without putting people at undue risk? And what choices matter in managing an uncertain future, along with many others. So data can help answer these questions and many other questions that you may have. And generally, there's a series of steps or processes you go through when you're trying to answer questions using data. And the first one of these is framing. So once you have your question in mind, what data matters and what data can you actually use to answer that question that you've formulated. The next is sources. So once you know what data you ideally want, where can you then go and actually find that data? And then once you have the data, how can you explore it and apply that data to answer your question? And then insight. So once I've explored the data, what are the answers to my question? What can the data actually show? And then lastly is limitations. So based off of what your data shows and doesn't show, or what it includes or doesn't include, what insight or what are the limits to my analysis? Like, what stories can I and can I not tell using that data? So framing, what data matters? Generally speaking, data tells a story about how a situation can change over time, or about the situation in this current moment. And it's important to parse the data that you need into the smallest components necessary So for example, if I'm interested in how hospitalizations from COVID have changed over time here in New England, I'm clearly going to need the data on the number of hospitalizations each week. But for example, maybe I want to compare states, and states all have different population sizes. So if I want to look at maybe hospitalizations per 100K people in a state, I'm going to have to go get additional data on the number of people in each state, the population of each state. I can also maybe compare how many people have been hospitalized compared to how many beds are available in that state. So again, that's another piece of data I'm going to have to go out and find in order to answer my question. If my question is, how many beds are being used by COVID patients each week in each New England state. And the type of data you're looking for is going to change depending on what your question is. So if I then wanted to parse my data between gender or race or socioeconomic class, it means I'm going to have to go out and I'm going to have to find that additional data. So where can you find the data once you've kind of determined what you need? So generally, again, individuals don't publish data. It's the institutions that publish data after they've gotten it from whatever sources they've been using. So it's important that you identify the institutions that have the data that you want, and to look at a lot of places and to follow threads. So this is a conceptual map. We could have drawn a lot more arrows. It can be really messy sometimes. The process you can take from actually to actually get your data set. So just as an example, a pretty common thread I've found while working with data is that I find a news report that is related to my question in some way or form that links to a governmental report. And then finally, within that report, I get to my actual data set, something I can actually download and start analyzing. But there was also a time where maybe I find a private industry report and I know it has the data I'm looking for, but that private industry report is locked behind this paywall because I'm not a part of that industry. So then I had to call the number listed, explain my situation, and then they were kind enough to give me the data that I was looking for. So again, there's a lot of different threads to get to data. Unfortunately, it's not always easy or in a centralized location. So you just need to do what's reasonable for you and yeah, follow whatever path you can find. So congratulations, you have found the data, you've opened it up, and it's this big, dense spreadsheet. And now the question is, well, how can I actually use this data that I have? So this is where the exploration comes in. And the example here is that we are trying to figure out the utilization rate of ICU beds here in New England. So I know it's somewhere in this data set. And now the question is, how can I actually pull out the information I need in order to answer that question? And what I generally do when I first open a spreadsheet is that I work through the columns individually to determine which ones are actually useful to me. And then I can just ignore or delete the ones that aren't useful. And a data dictionary can be really helpful when determining what is actually included in each column, maybe what's meant by a column header. And a data dictionary is often either a separate file altogether that has a list of the column names and then a description or a dictionary, a definition of each one. Or it can also just be a list on the website that you downloaded the data from. But so, for example, these are the first 6 columns of that giant spreadsheet on the previous slide. And as you can see, so object ID is an internal identification number from the website that this data was downloaded from. So it's not useful to our purposes. We can ignore it. HHR city and HHR state are identifying columns. So an HRR is a hospital referral region, and that is a region where people within a region go to hospitals within that same region generally. So when we see here Bridgeport, Connecticut, the data includes a lot more than just Bridgeport, Connecticut, but Bridgeport, Connecticut is the sort of central or the largest city within this specific HRR. So this is just a name that allows us to identify which region we're talking about, because a lot of these HHRs cross state lines and county lines. So again, just kind of knowing what you're looking at. So the next column is, we have a column called valid, which is clearly the date that the data is talking about, but a valid's kind of a confusing column header, so we might want to change that. And then last, comp-hosp is a really good example of where a data dictionary was necessary and extremely helpful, because with the data dictionary, we know that this is the number of hospitals that reported data on each day. So once you've kind of gone through and identified which columns are helpful, through this kind of initial exploration process, you might find that the data is not actually currently in a form that would make for analysis to be easy or doable. So this sort of process of formatting the data for your analysis is also often referred to as data cleaning. And some questions you can kind of go through while you're cleaning is the data correctly formatted to allow the operation I want to perform? Is there any data that's missing? Do some columns or rows need to be combined before they are useful? And is data duplicated or mislabeled? And again, this is an example from this hospital bed and patient and utilization data. And so as an example, we see that for Burlington, the HHR, that there are 2 rows per day, and that's because half of the Burlington HHR is in New York, which is FEMA Region 2, and then half of it is in Vermont, which is in FEMA Region 1, New England. So we see that there's a row for each of those for each day, but we're not interested in the different regions. We're interested in just Burlington as a whole, as an HRR. And then we have valid, which again is a confusing column header. And then the last 3 columns on the right, we can see it's inpatient beds and patients. And again, from the data dictionary, we know that inpatient includes both ICU, intensive care unit, and non-ICU, so people in general admission. And we know that ICU patients definitely shouldn't be in general admission beds, and general admission patients shouldn't be using ICU beds. So if we want to consider them as kind of opposite populations, which we do, then we need data on both ICU and general admission. So right now, to do those separate analyses, the data is actually not in a format that's completely useful. But after cleaning, I have now just 1 row per day. I've combined the rows. I have a clear column header in date, and I now have columns that are both ICU and general admission, which means I'm now good to go ahead and start my analysis, my data crunching. And a pivot table can be helpful to both identify these problems and to do some of these summary statistics if you're using Excel to explore your data. So here's an example of a pivot table, just briefly, because you could go pretty in depth with these, but it's a very helpful tool, and some people don't know about it, which is why we wanted to highlight it. Again, this is in Microsoft Excel. On the right is the input. So once you go and input pivot table, these are then the values that you would drag into these boxes. And this is the output that Excel would then display to you. So as an example, I have the number of ICU beds and the number of general admission beds in Burlington and Lebanon, which are the 2 hospital referral regions that have large portions of Vermont in them. And then the average of those beds for each week. So this allows us to both compare between weeks to see how the number of beds are changing week to week, basically across the month of January. And then pivot tables also summarize all of these sub weeks. So we see that for the month of January, Burlington on average had 74 ICU beds and 581 general admission beds. And then we can also compare between HRRs. So we see, to get kind of an idea of the scale of each one of these, that Burlington has about half as many hospital ICU beds as Lebanon does. So again, just a very helpful tool to kind of visualize and again, get a nice firm grasp on your data. So once you've done your exploration and your data is how you want it, the next step is to format the results in a way that's meaningful for your analysis, for you to actually answer your questions, which is what you set out to do with this data. And this is an example, again, taking that hospital data, which was that big spreadsheet on that previous page. And now we see for each HRR that has portions of New England in it, we have all these breakdowns, and that kind of funnels into this sort of master statistic, which is the total utilization rate. So that is the percentage of hospital beds in each of these regions, how many are currently in use, which tells us how many is available. So if there is another COVID surge or any other reason that hospitalizations would suddenly spike, what's the situation in each of these regions? Do they have the capacity to absorb that and to still be able to treat patients? Or if they already have a really high utilization rate, they might be at risk of running out of room for people if we saw another spike in hospitalizations. So this is, it's a really nice comparison to statistic that can then be told to people who can maybe give additional support to a region that needs it, or just monitor one if we're seeing concerning trends. So once you kind of have your data and your answers, the question is, well, what is my data showing? And so just kind of as a overall point, insights are framed by the data that was collected. So kind of going back to that first framing slide, you can't examine disease trajectories or hospitalization trajectories by gender if you didn't collect data on male-female breakdown. And it's also good to ask, was there anything surprising when I was doing my analysis? Are there any thresholds that matter? So in our case with hospital utilizations, it's sort of 80% would start to be kind of, we're concerned that they might need additional assistance. And also, what patterns do we see in our data, in our analysis? And as an example of a pattern that we saw, we were looking at the general admission hospital bed utilization rate over time. So again, these are the two HRRs that have large portions in Vermont. And we can see that, first of all, they're very similar in utilization rate, but after the holidays, we start to see this increase. And we know from other data sources that people had these close social gatherings, mostly indoor gatherings, around the holidays, and then it takes time for people to develop symptoms and to develop symptoms that are severe enough to then be hospitalized. So we expect, and it makes sense that we're seeing this increase in hospitalization rate after those holidays. And if it had increased, continued to increase, we would have started to be concerned, but luckily it starts to even out and go back down. So this is all a story that we can tell from our data analysis. And my last slide is the limitations. So again, data should be applied to the context that produced it. Where avoidable, Vermont data shouldn't be applied to Massachusetts. Data from men shouldn't be applied to data from women when avoidable. It's really important that you state any assumptions that you made in your analysis and that you state how those assumptions could impact uncertainty in results. I like to say that you, as the data expert, you know what your data is showing, what it's not showing, what assumptions you made, and what limitations exist from those assumptions. But you're passing that data and that analysis off to someone else who is then going to actually make the decisions or use it to inform something. So if you don't correctly document all of your assumptions and your limitations, that other person might make conclusions that aren't actually appropriate. So it's really important that you, as the data analyst, is clear and open about your analysis. So now I'm going to pass it over to my colleague, Jeff, to talk about the data use in the coronavirus response, more specific examples.
Thank you so much, Caitlin. If you can advance to the next slide. Great. So for my portion, I'll be talking about two different tools that we developed, one the vaccination tool and the other a Paycheck Protection Program dashboard. I'll talk about how these tools have helped inform our regional efforts within New England. Talk about the data sources, where do we pull our data from, and lastly, the methodology, how we used it. And for each of these tools, I'll give a quick demo. Next slide, please. So for the vaccination tool, this is something that we've been working on over the last month or so. We wanted to understand the supply that was incoming into our states in New England. So how many vaccines are each state receiving? And what's their capacity to administer those vaccines or give shots in arms based on existing centers? So the reason for this was to try to maximize efficiency and reduce waste to make sure that stockpiles don't get too high. And therefore, we have vaccines that could have been administered, but were not due to lack of staffing or infrastructure. And to identify a need for when a state may need additional centers or federal assistance. Next slide. So the data sources for this tool, a lot of the data that we're using is publicly available from the CDC's website. This includes doses administered and shipments about doses in transit or allocated and soon to be shipped. And then the Tiberius data set, the Tiberius portal gives us a little bit more detail about some of these topics. This is behind a firewall and it's only available to government employees, but it can tell us a little bit more about vaccines, waste, and inventory tables, as well as some finer scale information about deliveries. Now, the CDC data that we're using on the CDC's website is only available for the present day, and we need a lot of historical data. So there are some groups and web pages that collect this data and which we are pulling from for this tool. So we're using ourworldindata.org, which basically collects data from the CDC and stores it for data scientists. Next page. Okay, and Caitlin, here I'm going to actually go and share my screen so you can relinquish control. Excellent. So here I'm sharing a picture of the tool that we developed. I'll walk you through it briefly. This tool in the upper left-hand corner, I can select the state that I'm interested in. So I'm going to select Vermont. And I can see in the graph, it shows me that CDC data, so the number of vaccines that were administered each day in the red line. We can see in mid-January, Vermont was administering about 2,000 vaccines per day. And currently, Vermont's administering about 4,000 vaccines per day. The dotted vertical line represents the last day data was pulled. And then we also project this trend out into the future. So the default value based on the trends that we've detected are that there are going to be 41 new doses administered per day in Vermont. To construct this dashboard, we ingest data using R and analyze it. And then there's a package add-on called Shiny that we're using to display this data. Shiny has a lot of nice interactive features. One are these slider bars where we can change some parameters within the code. So this here, we're allowing the user to alter that forecast, the amount that they'd expect doses to grow. So let's say that Vermont is expecting Janssen vaccines to really increase the state's ability to give shots in arm over the next few weeks. We can ramp this up accordingly. Now, what this is showing is that the horizontal green bar represents the state's capacity to administer doses. So it's about 5,500 doses that can be administered per day based on the existing infrastructure. If vaccines, continue to be administered along this trend that we're, producing in this scenario, we can expect to exceed Vermont's capacity to actually administer those doses on March 15th. So what does this tell us? This tells us that there's either a need in Vermont for additional centers to vaccinate, or that we need to increase the efficiency at the centers, meaning the throughput, how many people they vaccinate per day at a given site. Default values are provided here, but it's kind of like a mortgage calculator. The user can update these accordingly if they have better, more recent information. So here we've identified through various sources that 40 pharmacies are participating in vaccinating the public. And in this scenario, if we were to change it to 45, we can see that that pushes the date out a bit more until we reach capacity. And then we can also see, like, let's say we train our pharmacies and our staff, supply supplemental staff, and are able to increase the total doses per day at a given site, at a given pharmacy, from 50 to, let's say, 75. We can see that solves our capacity problem within the next 2 weeks. It raises the bar for the number of doses that we can administer per day, and we're no longer going to exceed that capacity under this scenario. So that's the tool in a nutshell. Some challenges are that this default value that we are providing, again, as I mentioned, is from multiple sources and it's incomplete. For some states, it's more incomplete than others. So if I go to New Hampshire, for example, we clearly are not capturing the full picture of the number of centers that are participating in the vaccination program, because this shows capacity being exceeded on February 15th or around then, where it clearly was not. So the way that we address this issue is, to, provide the best default values that we can, but to allow the user to update them accordingly with more current information. And then lastly, this is available at the state level. We'd really like to, look at how we'd exceed capacity for each vaccine type, for Moderna and Pfizer and Janssen vaccines separately, since most sites are just administering one vaccine or another, as well as to look at a finer scale at a county level, or to look at an individual site level. But for right now, the data is only available at the state level. And so we're kind of viewing this as an average. It's an average for when the state as a whole will exceed capacity. And we're working on getting more data. And as time goes on, more data within Tiberius is becoming of higher quality and may help us answer some of these questions. All right, Caitlin, I'm going to pass it back to you to share the presentation. Great, thank you. So can you move to the next slide, please? All right, and then the second tool I'll speak about today is our PPP tool. So this looks at how the CARES Act funded Paycheck Protection Program was rolled out across different business areas. So who is receiving which loans, and how does that represent the proportion of that sector in a given county? This can help us identify areas that are in need of outreach. So which counties have very low uptake for the PPP loan program. And it can also help us evaluate the program effectiveness. Next slide. So to calculate penetration rates, we were looking at a number of different data sources. The first was we need to kind of understand the total number of businesses that exist by NAICS code within each county or zip code. And so we used the Bureau of Labor Statistics data for that. And it's pretty current, it's from 2020. For the numerator, we also need to understand who's getting which loan for what amount, what their NAICS code is, and where they're located. And so SBA provides all this data. It's publicly available. And in fact, all this data is publicly available. And the US Census Bureau, we're pulling several different data sets. One is county business patterns. This is another data set that describes the number of establishments for each business NAICS code in each county. And we're using the American Community Survey data to understand median household income. Next slide, please. Okay, great. And I'm going to finish up by sharing my screen one more time. Okay. So here's the tool, the Ppp Dashboard Tool. And the user can select the NAICS code that they're interested in. So for this example, I'm going to select NAICS code 611, which is educational services. I can see my New England states represented here in the bottom. The data is represented in a variety of different ways. So each county has a circle associated with it. The circle represents a couple pieces of information. The first is the number of establishments, and that's represented by the size of the circle. So if I click here on Middlesex County in Massachusetts, I can see it's one of the largest circles in the map, and that's because for educational services, it has the most number of establishments, over 1,000, so 1,100 establishments. Whereas, let's see, Essex County in Vermont, let's see if I can get, there we go, only has 3 establishments. So that's that data is displayed with the size of the bubble. Then there's also the coloring. So the darker bubbles have higher penetration rates. So let's see here in Chester County, it's a smaller circle. I have 27 establishments, but all 27 of those received PPP loans during the first round of funding that ended in August. So that represents a 100% penetration rate, and that's why that circle is very dark. Whereas if I look back here at Essex County in Vermont, none of those 3 establishments received PPP loans, and therefore it's a very light color. And then each county receives a color as well, and that's coming from the median household income. So the lighter county colors are the poorer areas, whereas the darker are the richer areas. So when looking at this map, I might be particularly concerned about large circles that are light in color that are overlaid on a light county. So that represents a lot of businesses that are not receiving loans in a low income area. While Essex County in Vermont only has 3 businesses, none of them received loans, and it's a low income area. So that might be a region that I'd want to target for future outreach during the next waves of PPP funding. We're going through one right now. For example, and I can also, would want to dive down to a greater scale once a county is identified to find out where these establishments are. What are some of the barriers for why they didn't receive funding and take advantage of this program? Was it because they didn't know about it? Was it technological barriers? Maybe it's they didn't have access to adequate broadband. Maybe there are language barriers. Some of these providers maybe speak English as a second language, and it's difficult for them to fill out an application. Or maybe it's some other barriers, like they don't know how to perceive their business to perceive their enterprise as a business, and therefore they're not sure how to fill out some of these loans accordingly, if, let's say, they're childcare providers. Okay. So I'm going to jump back to the presentation for my last slide. Thanks, Caitlin. So some of the limitations here that we had around data are that, like I mentioned, to determine the number of establishments, which is really that denominator value, we had 2 data sets to choose from, and neither of them were perfect. So that created a little bit of a conundrum for us. The first was the BLS data set. This has it's up to date. It's from 2020, and it has a 3-digit NAIC code, which is nice. It allows us to dial in a bit deeper as we get more and more digits for NAICS codes. It's a finer subset of that business sector. However, this data set doesn't include sole proprietors or independent contractors. And so we also have to exclude them in the denominator from the SBA data, and in order to calculate our penetration rates to compare apples to apples. And for some sectors, this represents a very large portion of that industry. And it's not a good representation. That penetration is not going to represent the true penetration of that industry if we're excluding sole proprietors. So that brings us to the Cbp data set. This was our other approach. And this does include sole proprietors and independent contractors. However, the flaws here are that it's only available at the 2-digit NAICS, so it's not as fine of a scale as we'd like. And the most recent data, it was available in 2018, so it's not current. So neither of them are perfect. The way that we got around this limitation was just to take both approaches, create maps using both approaches, and to be transparent about if the BLS data set was used to calculate a penetration rate, to inform the user what percentage of those establishments were excluded because they were sole proprietors in that penetration rate. So you can go to the next slide, Caitlin. And with this, I'll pass it on to my colleague, Benjamin Trump, who will talk about how data can inform policy. Thank you.
Thank you, Jeff. Great. So in the next few minutes, I'm just going to be going over a little bit of analysis that we've tried to do to try and make sense of what's going on in our communities: economic, social, public health, infrastructure, and many more. And within all of this, the core question that is driving a lot of our work and the work of many others that engage in data analytics and policy analysis is basically 2 things. First is we want to try and figure out, how did we get to where we are? What are the different data points and factors and events that may have influenced behavior or activity within our counties, within our states, within our regions, for the better or for the worse? And probably more importantly, number 2, where do we think that we may be going in the immediate future? So with data, what you can do is try and marry together multiple different data sources and try and compose a narrative that explains what's going on across our entire state or subsets of our population. And then try and see, how different policy initiatives, federal, state, local, as well as a variety of events such as the resurgence of COVID in the second wave, have affected our population in different ways. So next slide, please. The core driver behind a lot of this is, at least in our team, intellectually, we're trying to make sense of, across different eras of the pandemic, time periods where we were explicitly trying to blunt the disruption from the pandemic. So if you are on our rightmost image, a lot of what the response was when you're going back to February, March, April, May of 2020, was we were trying to keep many core systems, be it food services, be it digital infrastructure, be it commerce and finance. We were trying to keep these systems operating with as minimal disruption as possible. And by and large, the reason being for that is when you have an active crisis, You have loss of fidelity of many of our activities and both individual behavior as well as top-down behavior from large companies, different government agencies. We're all acting in a way that was basically on a crisis footing. It's very different than normal life, and we saw this play out in many different ways. Everything from of course, people staying at home for lockdowns, disruption of food supply chains when we saw the price of beef go way up for a while, and honestly, many foodstuffs are still very expensive. Um, Down to everything such as an increase in housing prices, which is not something that many economists forecasted was going to be something that we would see as the pandemic progressed. So what a lot of the initial policy footing and emergency response was could be largely packaged into on this bottom left of our image, trying to limit the amount of disruption that we would experience and have to dig ourselves out of. Increasingly, what you're going to start to see, and what a lot of the current stimulus and policy discussions are, is, well, how do we incentivize resilience and recovery and adaptation? In many respects, there are different functions of society that we would like to see go back to their pre-pandemic state, and there are others that we would like to see bounce forward. So within all of this, what we're trying to do is use different data sets from different pedagogies to try and form these narratives. How we are, why we are the way we are, and more importantly, where might we be going in the next several months. Next slide, please. So what we've done is we've created a policy tool, again, that is meant to be as user-friendly as possible and tries to marry, well over a dozen different data sets that go through everything from consumer spending and financial practices to business and hiring, to foot traffic via cell phone data, to food insecurity of general households and households with children, and many others. And within this, we weren't trying to get ahead of ourselves and draw a lot of causal analysis to try and draw any specific determination that variable X caused Y. I'm sure that's going to be discussed for years to come. But right now, what we're just trying to make sense of is how are variables at least moving with one another, whereas we're not quite sure that one caused another just yet. But so if we go to the next slide, one of the things that we've been looking to do is looking across the progression of the pandemic to try and see how different states have performed over time. And what you're seeing here is a lot of performance from Vermont. I'm going to be going over through a demonstration. I'd love to take your questions. But what we're looking for is, rather than any single variable, trying to say, well, how is mental health in Vermont over time, or what is the food insecurity situation? We try and draw multiple narratives and multiple different data sources together at the same time to draw a more holistic, complete story. So what I'm going to do is I'm going to go ahead and share my screen with the tool that we have developed. So just bear with me 1 minute. All right, can everybody see that? I hope so. What we have here, again, is just, it's an open source link. This link is available for your use. It's public and online. And what we've done is we've taken multiple data sets that we have tried to compile into 4 different screens that we can visualize from. And what we can see is we can either look at the same state and different variables. We can look at different states in the same variable, or any combination of all around. So I'm going to go through a brief demo of how I would use something like this. But please feel free to just interrupt me at any time. I'd love to have your questions, or if there's maybe some hypotheses that you're interested in or want to see how some of the data might look. I'd love to showcase what we do have. We certainly don't have all major data sets, but we certainly have many of the important ones relative to social movement, economic performance, et cetera. So one of the things that we've seen is Vermont is very much a unique case when you look at the U.S. performance with COVID. They had very effective lockdown measures. So there was this initial bump. If we look at our top left graph, which is our incidence rate or new cases per 100K on a moving average. we did see this initial bump with COVID cases, but even if you account for some inflation factor that we weren't necessarily testing as effectively across the country in March and April, relative to most other states, Vermont did quite well. They were able to quickly return back to a very low incidence rate throughout much of the late spring and into the early fall. But then what we saw, and similar story to much of the country, is once you get into the end of October, and certainly as we got into November, we saw a rather significant resurgence of cases. And this could be due to many reasons. The weather is getting colder. We saw many school districts begin to reopen. We saw a lot more COVID fatigue, where people were just trying to get around some of the rules, even temporarily. Of course, we had many major family gatherings and federal holidays around this period. And in general, this was a time period that it's not just Vermont or even just the United States, but pretty much the entire Western world went through a very significant increase in cases within a relatively short time. Now, what you're looking for within an incidence perspective is, are you breaking critical thresholds? There is no gold standard that applies to everything, but the general number that I would offer to people to look at for incidence is, are you getting above or below, at maximum, 20 new cases per 100,000 in population? And preferably, are you staying under 10? The reason for that is that's roughly the rate where we can expect to have, certainly under 20 and preferably under 10, to have more effective contact tracing. Once you get beyond 20 new cases per 100K, it becomes a bit too difficult for a typical contact tracing outfit to be tracking all new cases as well as all the physical contacts that those cases have had. So especially once you get under 10, it becomes a lot easier for new cases to be tracked and traced, and hopefully for us to be limiting secondary and tertiary infection down the line. So Vermont certainly, unlike much of the country, did very well, had a lot of great measures to keep cases low. But then once the weather got a lot colder and we had these family gatherings, we saw cases surge once again. Now, if we go to the bottom left here, so what we're looking at is card spending. And this is probably our best proxy measure for consumer spending, which is going to be a big driver of, how is your local economy doing? Again, this is quite unique to much of the country. I've looked at all 50 states in this regard. And one of the things that you see in Vermont that is the same, if you only look at, about, April 15th, March 1st to April 15th, every state has a very sudden decline in its card spending. And often this decline in spending is before many states even issued stay-at-home orders or stay-at-home guidance. In many cases, you're talking about a 30% reduction in spending or less in a very short order. Now, most states at the same time also had a very rapid recovery, but certainly not at the level that we saw in Vermont. And so in Vermont, we saw a lot of consumer spending. Again, this is aggregate, all card spending, any card spending by any individual within Vermont. Regress back to the mean from a deseasonalized average very quickly, and then once we got into the summer, we saw that spending was actually greater than our pre-pandemic rates. It began to falter again once we got around the Thanksgiving timeline, but once you saw more stimulus activity, and we saw more job offerings within this area, you saw a sudden spike in increase in card spending again. This local maxima corresponds pretty well with the timing of that initial $600 stimulus check, as well as an increase in unemployment supplement benefit. I would bet that you're probably, assuming that another stimulus is passed, you're probably going to see something like this happen temporarily again. But if you look at the top right, it's great that consumer spending is going up. That's a sign of a very healthy local economy, particularly at a time when much of the country, they're seeing 15% reduction, 20% reduction, 30% reduction in spending. But if we just stick with this variable, you can disaggregate that and look to see, are there some categories that are doing a bit worse than others? So if we just look at transport, so this is, taxi cab drivers, rideshare, warehousing. Within this, again, we saw some measure of recovery, but unlike much of the broader economic and spending activity, what we did see is this sector certainly lagged behind quite a bit. Now, let's go to just one more. So if we look at accommodation and food service, these are our restaurants and hotels. Again, so this sector certainly lagged across the general consumer spending across Vermont. However, it was these curves right here are certainly far more preferable than what we saw across much of the country. And my bet is, again, you see about in early January into late February, this sudden resurgence in spending. Again, this is very closely timed with the reactivation or refunding of many stimulus measures. The hope is that we can trigger this again going forward. But so that's, we're looking at sectorally, how our spending is playing out. But what I will say is it's not enough to see how is consumer spending looking at, it is where is this money going? And more importantly, what are the possibilities that people could be spending money on of the different vendors available to them? So one thing that we also looked at is from a small business perspective, what is the percentage of small businesses that were open relative to a pre-existing benchmark? And again, the overall narrative, and this is probably unsurprising that this did happen, but might be surprising just the sheer magnitude of it, is the Vermont small businesses decreased significantly between mid-March to mid-April. And what we saw is, almost a 50% decline in small businesses just being open. This did recover, certainly not as well as other businesses, but did recover. We still had about a 20% reduction. My bet is this difference here are probably businesses that either closed for good, they never intended to reopen after these initial closures, or had certain financial or labor restrictions for doing so. So we reached this plateau with small businesses, and again, this surge is certainly buoyed by Ppp, as Jeff went over. But then as many of these benefits started to falter a little bit, our cases went back up, unemployment began to surge. We saw small businesses begin to start closing again, and have only recently started to recover. So certainly an area to be concerned with. So I know that there's a big focus with the folks in this audience about working with children from a public health and wellness perspective. This bottom right, just for clarity, is foot traffic. Using cell phone data, where are people spending their time in foot traffic? But I'd like to open this up to just a few, and please stop me with any questions. I'll go through just a couple more examples. Just a few quick examples about childhood education and childhood and availability of food. So if we just look at on this top right, is the percentage of households that have internet available during education hours, sometimes, rarely, or never. So once you get to that sometimes level, that means that you have kids that are missing school in a lockdown environment, teleeducation, and they have some amount of hours that they're missing that they are supposed to be reporting for school. So we, in all states, saw rather significant surges in this into late spring and early summer. Over the summer, of course, many schools are out of session. We did see, some summer camps and other offerings, but this certainly did improve. But once again, we got into our second wave. We saw internet availability, which households with children skyrocket again. But after stimulus spending, this certainly did improve. Where the prior round of stimulus in December and January did explicitly target some measures related to school reopening. So we have seen an awful lot of improvement here. Now, if we go over to just another quick example with food insecurity. Excuse me 1 second. Yeah. So if we're just looking at general caloric deficiency, So it has less to do about the nutritional content of food, but just from a caloric perspective, are you getting enough to eat? Looking at households with children, again, like much of the country, you did see this rate skyrocket. It more than tripled in the early months of the pandemic. There was a general improvement as the CARES Act began to unfold. But as the CARES Act sunset, we saw these rates increase again, particularly as the second wave unfolded. And with the second wave came higher rates of unemployment. And with high rates of unemployment came many struggles with things related to insurance, food security, of course, household spending, and different factors like that. So again, we see this number change. It changed quite a bit. In general, it seems to be trending in slightly the wrong direction. But again, the big question to be asking ourselves is, as our cases recede and as the employment rating gets a little bit better, and as our stimulus package rolls out, will we start to see some general improvement like we saw over the summer months? So I'm happy to go over any other cases, but I do want to stop here for time, see if you have any questions, and thank you, of course, for listening. Looks like we did get a couple of questions. So so I got a quick question about data sources. Are the data sources available for all of these measures? Short answer is yes. Be happy to reach out to you with the data that we're pulling from. We pull from a number of sources. And we tend to favor public-facing data because I want to make sure that I can share everything that we have. But one thing, the good thing about this pandemic that I've seen from data is, outside of some very specific public health work, particularly dealing with personally identifiable information from a healthcare perspective, a lot of our economic and social and infrastructural data has been widely available. That's certainly been very helpful for data science. So looks like Stephanie sent in a couple of questions. How can we use data to tell meaningful stories to the audience? And if any other panelists want to step in, please let me know, but I'll take a first stab at that. Again, it's at the end of the day, the single most challenging thing, both top down, at a macroeconomic level, when you're talking about the Federal Reserve and OECD and others, just from down to the bottom up, the general household level, everybody's trying to make sense of what's going on. There are 1,000 different things happening at the same time. And policy activity, economic activity, opening and closing and everything in between. It happens so fast that it's very, very easy to find yourself sort of lost in the weeds. So in telling these stories, what we try and do is, one, don't overcomplicate things, but two, try and draw scientifically backed information from multiple data sources in multiple sectors. So don't just focus on a single silo of public health or food insecurity. Talk about, the case rate, the progression of cases related to unemployment, related to food, related to spending, and then you get a more complete picture of, there is something going on within the general health of our state, with the general health of our society, that is trending better or worse. We can never offer hard predictions of what's going to happen because a lot of acute events can sort of shift us in one direction or another. But we can certainly get an idea of where we think we might be going. So Jeff, I don't know, Jeff or Caitlin, I don't know if you wanted to add anything as well.
Sure, I'm just looking at a few of the questions here. I think we've covered most of them. As far as how to improve existing data skills, including data mining or cleaning or analysis, I think if you want to step up your game outside of Excel, so to speak, I would highly recommend taking a basics course in some type of programming. R is a language it's free. There's a lot of resources. It's open source. Anyone can download it for their machine. And I think it's very powerful statistical language. or Python is another very popular one. So that would be my recommendation there. And there's tons of free online classes and tutorials to do so.
Yeah, and just on that point, there's, even if you have taken a course on R or other data analytic focuses, I know, like, at least from my personal experience, if you haven't used that for a while, you kind of lose those skills. But I found really good success with just Googling even. So in Excel, how do I get a pivot table to group something by weeks? Or using R, how can I change my columns to my rows to my columns? And there's really strong communities and websites out there where you can get a lot of help. And I think it's becoming more and more accessible to a broader audience.
And I think part of the challenge there is that, many people who are new at this, they don't know what they don't know. And there's so many great tools and functions, even within Excel, that can do amazing things with data. And, so I've kind of, when I'm working in Excel, for example, I've used my background in programming, and I was like, oh, well, I bet Excel can do this type of thing that I've learned from the programming world. And in fact, there is a function in Excel that can do it. And you'd never know if you didn't understand that concept from some sort of training or having come across it elsewhere. So definitely kind of a course is the way to go. And I think we're running out of time here, and we've covered most of the questions. So maybe we can pass it back to the host, Dora, if you want to take over.
Wonderful. I would like to just thank all of our panelists, and there are many opportunities, again, to be involved in either in this group, or I do want to encourage people to go to vermontkidsdata.org, which is hosting a lot of great data, and also is going to be doing a little bit more about data literacy and promoting some of the resources that this group has been coming up with, specific to childcare in Vermont and support from FEMA. So thank you again, and I think that will wrap up for today.
Thank you.
Yeah, thanks for having us.